Hey there. Good evening. Good evening. My phone is over there. Let me grab that. Welcome, everyone. It's Monday night, and you know what that means. Senior Pet Chat time. Good evening. Good evening. We'll wait a couple minutes and let some folks join us while I make sure all of my lines are open. Want to make sure all my chats are visible to me so that if anyone has questions, I can answer them. Or if you have answers to the questions that I pose, that I am able to see all of your comments. So if you are here with me tonight, feel free to go ahead and put your senior pet's name and breed in the chat. We know that it's not only just cats and dogs who have senior issues, but we have all kinds of animals that come to the clinic and who see changes in their pets as they get older. Reptiles, birds, smaller mammals, even fish. Some people, I think, don't koi live for a very long time. And I'm sure those fish and other species that live for a very long time experience senior issues. You guys, you're here. It's the Senior Pet Chat with Dr. Croom. And again, we come here every single Monday night at 7:30 across several platforms. Why do we do the Senior Pet Chat? Why did I take it upon myself to choose this as a topic? I just love senior pets. I love being able to, as a holistic veterinarian, give their bodies a chance to rejuvenate and heal themselves. That is all a part of holistic medicine. For those who are curious, we add all aspects of the animal's body, mind, spirit to allow it to heal itself. So tonight, our topic, you may have seen our post about this earlier. Our topic tonight is senior pets and shoulder pain. Senior pets and shoulder pain. And one of the reasons I didn't just leave this as senior pets and their joint pain, because I'd say there's a pretty big misconception about senior pets and their joint pain. Most of the time when we talk about senior pets and their joint pain, there's this misconception that it's always the hips. The hip and joint, hips. And the hips are really, really important because they do bear a lot of the weight. Let's see. Hi there, Radhika. How you doing? You say hello for me and for Dr. Croom, Army Vet, and for yourself. Great to see you, Radhika. Let me see. And I'm going to go over here and open up my Facebook page and make sure that on my personal page, I'm able to see the comments here. So excuse me real quick. They changed Facebook recently. I'm like, what am I doing? I'm switching over here to switch over there. And let's see, am I able to see the video? We're live right now. Okay, is that today? Oh no, that was last week. Okay, oh, there we go. Okay, boom. See, what do you know? Okay, so again, misconception about senior pets and their pain, joint pain, is that it's all about the hips. That's what we hear the most of. And that is really important. This week I actually had to break out some of my show and tell. Remember show and tell? Man, I tell you, I'm going to try to be a little bit childlike every day so that I can have some of those good memories, of childhood and of things like show and tell. I love show and tell. My dad would always have stuff like this around the house. And I would always have something interesting to show after he taught me about it. So let's take a look at this actual live skeleton. This animal is, I'm not sure how old, but my dad, like I said, this is one of his tools that he used for his schooling and his teaching. Let's see. Okay, boom. Let's switch over to the personal page. So now, again, we said just now that one of the main misconceptions about senior pets and joint pain is that hip. We see that hip. We see what's happening here as far as looking at the physics and the force, that's put here. We know there's a lot of leaping and a lot of jumping, and probably with our some of our pets around here, a lot of jumping onto the sofa, right? Jumping right up, using those hind legs, using those hips. But I'm here to tell you about a little sometimes forgotten joint named the shoulder joint, okay? Very important, and have a lot of some of the same issues that the hip joints would have, but for different reasons. Sometimes with animals, just as with humans, they can compensate. If they have some issue in the back, then they're going to compensate on the front part of the body and sometimes get an injury in those areas, right? So today, when we talk about the shoulder pain, I'm going to break it down for you a little bit and show you just what's going on here. So you may remember from biology class, or if you took an anatomy class, that the shoulder is indeed a ball and socket joint. So you have that scapula, the shoulder blade, right? And the scapula, which you can usually feel that spine of that scapula. And then it comes down to the humerus. And together, there's that little acetabulum where the ball of the humerus fits right in. And that's what makes the ball and socket joint, so that you can do this and do that. Same thing with your dogs. Everything is held in by tendons and ligaments. We know that, okay? So this bears a lot of the weight. If you look at the percentage of the weight of this smaller dog, you can see there's a lot. There's a big old heavy skull. There's the neck and all the weight of all of this, then you've got this set of thoracic vertebrae, and the lungs are in here, and the heart. There's a lot going on here that the shoulders do have to bear. So a lot of times senior pets do have senior shoulder moments where they can sometimes be overlooked. So this is one of the reasons that I'm glad that I am here to do something like the Senior Pet Chat, because we don't want to forget about these things. We can't remember all of these things, and that's not your responsibility. It's mine. Hey, Vet Tech Tony, how you doing? Get it. All right, we're talking about the shoulder today. And let's see who else we have here on the line. Robert. Hey, Robert. Crazy Air Homes. You said Hayes. Okay. Oh, okay. You put the names of your senior pets in. Look at you following directions. Okay. You said Hayes, your niece's dog, and then Slider, your red-eared turtle, are all senior pets. Yes. See, this is exactly what we're talking about. It's not just cats and dogs around here, okay? And turtles, can also have issues with these various joints as well. Maybe it's not always about the amount of force that was put on, but maybe it's about their nutrient level, right? Maybe they go through a period of time in their 100 years of living, turtles, and maybe they went through a drought of a period of time where there weren't not much nutrients, and those shoulders break down. That calcium that allows that the calcium is seeping out of the bones because they're not getting enough in their meal. So yes, mixed dog. Hey, Dr. Lloyd, how you doing? So tonight again, we are talking about joint pain in senior pets, but we're focusing on that shoulder joint. A lot of times senior pets get osteoarthritis. We got inflammation in that ball and socket joint. They're putting a lot of weight on it. They're jumping around and dancing around and trying to get treats, right? They can get osteoarthritis. There's also some diseases that they can get genetically that affect the shoulders that, you just never know with genes. I tell you, I love genetics class back in undergrad. It was one of my first classes in undergrad that I was like, oh my God, I got an A, like in this hard class that's supposedly so hard. That's why I always tell the kids, don't just assume something is hard. Don't just assume gross anatomy is so hard. Get in there and do it yourself. You never know what skills are going to come out in yourself. Okay. So we're talking about the shoulder here and the fact that it's usually overlooked. And if you remember from back in school, the genetics teach us that you never know what you're going to come up with. You did a little Punnett square and everything like that. So one of the shoulder diseases that animals can come up with unexpectedly is called Osteochondritis Desiccants Ocd, and that's where it's the formation of the bone and the joint itself. I'm just like talking about, okay. Okay, so the OCD, that's when they're born with the joint not fitting together correctly. So then there's little flaps of cartilage that start to stick up. And I know you can imagine that sounds very painful. Okay. Hello, Gertrude Croom. How you doing, ma'am? Yes, yes, yes. So that's really, really important. I want you to know, yes, the hips are very important as far as a set of joints to be careful with, but take a look at this. Take a look at how all of there are so many joints in the body. And I just want to make sure that you understand that the hips is just one set, okay? We got, look at this elbow joint, right? And all these intricate bones coming together, rubbing against each other. Hopefully those little soft pads are in there, giving that cushioning that they need. But as they get older, even joints like the toes, look at that. There's a joint in each nail that allows them to lift their nails up and detract and contract and all of that. All joints, all can have pain in them. All can be crunchy, and not lubricated like they should. So just keep that in mind. If you've got senior pets, don't just focus on that hip joint. You got to focus on them all. Even as I was going through my chiropractic certification recently, they reminded us in between each rib, even there's a little joint in there that attaches to the spinal cord. All of these things I manipulate when I'm doing my chiropractic. So, all right. So yes, I had to bring out the show and tell tonight to talk about these joints. Now, one thing as the pets get older, we know that there's other things that happen like muscle mass loss, right? And that's going to affect the joints as well. The older they get, the more chances that they've had some trauma going on in their lives, that they've run up against the wall. Like just earlier, I don't know if you're on the line, Amani, but just earlier, my daughter came by and was throwing a little, ball for my dog. And she's like, and, she skirted right into like the wall, but she got that ball. And so this is the kind of cumulative trauma that can happen to a pet where maybe it's not just one, incident that happens. It's some repetitive things that are happening. And then we also have our pets that are show animals, right? Whether it's show horses, goats. We talked about 4-H recently with the 3 Wise Pet Pros. You've got all of these animals that are putting repeated strain on their bodies in different ways. I work with performance dogs quite a bit, and I have some very nice herbs for them. But just imagine all the strain. They go out for a full day, catching birds, straining their necks, coming back, following rules, and just breaking down all that muscle. So performance animals, really, really important. But I never leave you without some solutions, okay? So I always try to give you solutions that you can do right at home. Being a holistic vet, a lot of the things that we can do for our pets, you can find right in your kitchen or easily have and use for other things as well. I love to use coconut oil when I can. Obviously, every animal is different. Some animals might be allergic to coconut oil, but the majority are not. And you can get a lot of good, juju into those joints and lubrication by putting a little bit of coconut oil into your pet's food every so often. And one other thing that I have that is really exciting because, as an entrepreneur, it's nice to be able to have that continuation of care. Not only have a veterinary service for you, but also have products that you can use as well. So for those of you out there, I've got a special surprise. You know that I have my own line of pet CBD, and that can be useful for senior pet pain, as well as anxiety. A lot of times we think about that joint pain for the hips and the shoulders, and we think about how much of an impact that CBD has made on our industry in the past several years. Now, CBD is definitely not a cure-all for everything. Okay, I know we've been seeing it everywhere, and it's like, oh my gosh, it's at the gas station. Like it must be, a cure for. I've got this cut on my leg. Let me rub the CBD on. No, okay, it's not a cure-all for everything, but it is amazing. I will say that's one of the reasons that I, as a veterinarian, have decided to stand behind it when every veterinarian has not really necessarily done that. I've seen the research at various vet schools. I've done research myself with my own clients, and I 100% stand behind my Dr. Croom Army Vet Pet CBD. Now, when you go to drcroom.com to get the Pet CBD, I've got a discount for you. You already know about the tinctures. Those are very well known, 250, 500 milligrams, depending on the size of your pet. But what I also have, which you may not be familiar with, is I have my peanut butter blend of CBD, full spectrum CBD. This has an ingredient that has been used to help some of my pet patients with convulsions and seizures. Okay, so we never say that any natural product can cure or treat or prevent anything. That's illegal. But what I have seen with my pet patients who use this peanut butter is, oh my gosh, they're relaxing. I hear from their parent that, like, you can see in their eyes just like, thanks, mom, like this really takes the edge off. And so that's the peanut butter blend. You want to go to drcroom.com. Every time you order any of my products, you will always get a nice dosage sheet where you can see exactly what to do. This is something that I, as an entrepreneur and as a businesswoman, have seen out there. Nobody can read the tiny writing on these bottles, right? Even my bottle, you can't make it any bigger. So what have I done? I've eliminated that problem. So we have maybe senior pet parents as well, right? Who maybe need to pull on their old reading glasses out. Okay, that would be myself as well. I do have reading glasses, but you want to make sure that you're giving the right amount. And this peanut butter blend is really great for not only the pain of the joints, the anxiety, but also for animals that have experienced seizures. This might be something that you want to try to add on. Oftentimes, seizures are treated with pretty harsh chemicals. They're ones that any veterinarian would say, hey, your dog is having seizures, your cat is having seizures. You should probably start with these drugs. Those are just the gold standard for vets. But once you get into that, and maybe you're maneuvering around and seeing which drugs are working, keep in mind my CBD blend of peanut butter. I make it real easy to get that right into your pet's mouth and give them some soothing. So I told you I had a discount for you. For those of you who are watching, even if you're watching on the replay, you can use this code when you go to drcroom.com and you get any of the CBD products. You'll get 20% off by using the code SeniorPet. All right. So let's see. Trying to see if there are any questions over here. Hello, Mrs. Randolph. How you doing, Miss Pearl? Great to see you. Great to see you. Let's see. Jolynn, always great to see you here, ma'am. And Mr. Mitchell, Maurice Mitchell, great to see you, sir. And of course, I'm going to just mention my mama again. I don't know if you're on here still, Miss Gertrude Croom, but always great to see you. Bring a smile to my face. Again, this has been the Senior Pet Chat with Dr. Croom. I'll be on for about 2 more minutes. If you have any questions at all, go ahead and put them in the chat, referring to your senior pet, anything at all that I can answer for you. Let me put this code back up so that you see that. And all right, I'm out of here. I will see you next week, where every Monday night at 7:30, we're here for the senior, wrong banner. But you know what? Actually, before I see you next week, hopefully you'll join me and my other 2 business partners, the 3 Wise Pet Pros. We go live every Wednesday at 8 p.m. Eastern. So definitely right now, if you're watching this, go right on over in your Facebook to 3 Wise Pet Pros and join our page and our group. Okay. So this was Senior Pet Chat with Dr. Croom. Always great to see you. Thank you so much for those of you who joined me tonight, and I will see you soon. Take care of those senior pets.